Hi, my name is Angela Ross. I am a public health graduate student of Liberty University, and I have a concentration in nutrition. I come to you all from self-quarantine during the COVID-19 pandemic. Because of the global rapid spread of the virus, my hands-on portion of the practicum was canceled, and I no longer was able to go to the neonate intensive care unit, the pediatric gastroenterology, or the adult weight loss clinic. So I had to complete the remaining hours that I had just doing research for Peds GI as well as the adult weight loss clinic. Slide 2, malnutrition. Malnutrition includes obesity and is a major public health concern as it increases morbidity and as well as mortality rates. Malnutrition occurs when the body is not sufficiently absorbing nutrients or it's lacking appropriate nutrition. And this can be caused by poor diet, digestive conditions, or disease. The World Health Organization states malnutrition includes undernutrition, overweight, obesity, inadequate vitamin and mineral intake, and diet-related non-communicable diseases. So for those who are malnourished, a significant amount of complications can arise quickly due to the body's stress response, drugs or medication interactions, and the evolving physical state of illness or disease. Slide 3. Just a real quick background. There have been studies done on the correlation between malnutrition and the critically ill patient. And one study actually reports that of the critically ill patients that were admitted into the intensive care unit within the United States, of those 43% were malnourished. And another study was conducted between malnutrition and the mortality of the critically ill during an intensive care hospital stay. And it showed that those with malnourishment actually had a greater increase of mortality within a 28-day period. And those with the greater degree of malnourishment, the relative risk increased significantly. So nutrition intervention obviously is crucial for the critically ill patient, adult and pediatric. So for my time, I have been able to be with children, as I said, and adults, and the specialized care for the nutritional needs of children must include something different that the adults don't include, because children are still growing, they still have their brains are still developing, their bones, their organs, and so on. So it is imperative to make sure that the two are not equal and that the caloric intake, the micronutrients are in well balance. So let's move on to slide 4 and discuss challenges. And these include unstable or abnormal blood pressure. And with this, it causes an inadequate blood flow to organs. And that could starve organs. And so an accurate assessment of patients' nutritional needs, food intolerances, lack of standardized nutritional support, all of these things are optimal in the nutritional support of the patient. And it's critical, it's essential in order to assess the patient appropriately so as to combat any metabolic changes that may follow acute illness. Adequate nutrition promotes tissue repair, prevents lean muscle mass loss, mitigates immune system dysfunction, and minimizes unnecessary weight loss. And that is definitely something that we need to be cautious of. In evaluating patients, obviously we need to keep in mind the patient's age, the injury of disease, their nutritional status, post and pre-illness, the duration of their stay, of their illness. Without providing adequate support, we could exacerbate the illness. We could exacerbate and prolong the outcome. So thus far, I've worked with patients that are mainly under the age of 13. I've had a few adults, and I've worked in the pediatric gastroenterology clinic with their feeding clinic, and that means that they have children who usually are born with digestive issues. They're being fed by a G-tube or a J-tube, and the nutritionist comes in and helps with a formula pretty much, and just ensures that the child is growing on the height weight growth chart. If not, the weight in kilograms compared to the kcals increase, the volume of formula increases, and by formula I literally mean a specialized formula for these patients who have digestive absorption issues, and they cannot, they're unable to chew and digest orally, swallow. They have problems with actually swallowing. So we worked with many of them. I've met with celiac patients, and I have also discussed a lot of nutrition and the diet, how the diet plays a major role in healing the body and reducing undue stress on the immune system. And I was actually floored by the lack of knowledge from nurses and doctors and even some registered dietitians on, well, specifically celiac disease, and on processed foods, refined sugars, inappropriate nutrition, on inflammation in the body, and how sugars and other foods can impede healing and increase the risk of further complications. So that was something that I was really surprised by. Moving on to slide 5. I was able to evaluate 2 pediatric patients in the Peds GI, and one was a 4-year-old who was considered obese. One was a 7-year-old who mom insisted had celiac disease, but the doctor did not feel that it was appropriate to scope him and do an endoscopy or colonoscopy because of his age, and also he was having a good response to just a gluten-free diet. So we went over meals with patient 1, with the little girl. We discussed the portion size, which we discovered that mom and dad thought that portion size was the same as an adult portion size as it would be for a 4-year-old, and we provided them with information on my plate, which is on slide 6, and we discussed how drinking sodas should not be appropriate, switching over to sparkling water if she just likes the carbonation. Infused water recipes were given. The family seemed pretty optimistic when they left, and they were encouraged. Slide 7 is our patient 2. He was on the spectrum, mom says, of autism. So she had eating concerns with him, and so we discussed making eating fun, a little bit at a time. I gave her an idea for an app that goes onto your phone. You scan barcodes, and that gives you an idea if the product is gluten-free or not. We move on to slide 8, and this gave her a newfound freedom, honestly, to be able to go out and grocery shop and to not be concerned about glutening her child, basically. So with the adults, we discussed Chronometer, MyFitnessPal, and those types of apps for their phones to track their foods, because lack of proper nutrition has significant implications. And without a diet high in protein, calcium, and vitamin D, for instance, muscles become weak, bones become brittle. The major leading cause actually of injury in the elderly is due to falls and broken bones. So we want to ensure that we are reaching over to all aspects of the public in order to make sure that they have proper nutrients that they need. And that's been my goal since day one of this practicum. I've had the opportunity to see malnutrition in all of its forms in pediatric and adults, and I know that it is 100% preventable with appropriate balance of nutrients. And as I continue working forward, creating flyers and educational materials on foods, bathroom scales, weight management, celiac disease for both the adult weight loss and the Peds GI clinic, I will hope to lessen the burden of disease and encourage healthy habits and lifestyle changes in any of the malnourished individuals that come into those clinics. Thank you so much for listening.